Good day everyone, I am Leah May Villena from BSN 1201 and for today I will be demonstrating foot care. So the first thing to do is to introduce self and identify the patient's identity to ensure that the procedure will be given to the right patient, and also we are promoting cooperation with our patient and also to alleviate the patient's fear and anxiety. Then the next thing to do is to explain the procedure and then discuss how the result will be used to lessen the patient's fear and anxiety as well. So, good morning, ma'am. I am Nurse Leia and I will be your nurse for today. May I know your name, ma'am?
Ella May Villena.
Okay, Ma'am Ella. For today, I will provide a foot care for you to be more comfortable and also to assess if there's any feet problems occurring and also to improve the blood circulation on your feet. Okay, ma'am?
Yes.
Okay. And then gather appropriate equipment. So we have here our lotion, powder, alcohol, the liquid soap, the washcloth, the towel, and our nail clipper, our basins with warm water. And then next is to perform hand hygiene or hand washing. Then also observe proper infection control measures and then wear your gloves to prevent the spread of microorganisms. And then provide privacy to the client by closing the door or drawing the curtains around the room to provide comfort. And then the next thing to do is to prepare the equipments and the client. So put the warm water on the basin. So the warm water should be 40 to 43 degrees Celsius. And then position the ambulatory client in a comfortable sitting position. And if the client is lying on the bed, position the client in a supine or in a semi-Fowler's position to provide comfort. And then soak and wash the patient's foot. Okay, ma'am? I will now wash your feet. So soak. So while soaking, get the liquid soap and then put minimal amount of liquid soap and then wash the client's feet. So focus and provide enough attention on the client's interdigital areas because this is where microorganisms grow on the interdigital areas. Okay, and then rinse the patient's foot thoroughly. Okay, ma'am. So rinsing the foot of the client will remove the soap and also will remove excess residue that may irritate the patient's skin. Okay. So after rinsing, use the washcloth and rub the calloused area of the patient's foot. So this will remove callus formation. Okay. And then using a orange stick, clean the patient's nails. But this step is optional. And then remove the patient's foot from the basin and then place it in a towel. So the next step is to dry the patient's foot thoroughly. So drying the patient's foot will reduce risk for infection. And then apply lotion or powder. So lotion will lubricate the patient's skin and the powder is a great absorbent. So with the powder, it will reduce excess perspiration. So okay. exercise the patient's feet by flexion and extension to improve blood circulation. Okay? Okay, ma'am? Is it good?
Yes.
Okay. And then, after that, trim the patient's nails, but if only required. Okay, and then, okay, ma'am. And then, after that, just repeat the procedure in the other foot. Okay? So, get warm water, and then, place the foot in the warm water. Okay, so, okay, ma'am. So, wash. So, focus on the interdigital areas. Okay, and then rinse. Okay, after, then rinse it thoroughly to remove excess residue. Then, after that, use another clean washcloth and rub the calloused area to remove calloused formation. And then, using an orange stick, clean the nails of the patient, but it's optional. And then, remove the patient's foot from the basin and then place it in a clean towel. So, dry it thoroughly as what we did a while ago to reduce the risk of infection. Okay. And then, again, apply powder to reduce excessive perspiration. And then again, exercise the patient's feet by flexion and extension. Okay, and then trim the nails of the patient if required. So, trimming the patient's nails with nail clipper will remove excess residue that may harbor more dirt. And then after that, remove and discard all the equipment. So, to remove and discard all the equipment, so your gloves, and then, so after that, so perform hand washing to reduce the spread of microorganisms. So apply alcohol. And then after, record the procedure done on a sheet. So we have to record all the procedure that we are doing. Okay? So that would be all. Thank you.